Compassionate Care. We have been in existence since about 2012. We are in existence to help with education of end-of-life planning, setting goals for our lives, of advanced care directives, and POLST, physician orders for life-sustaining treatment. We are a community organization that falls under the Ventura County Medical Association. They're our fiscal agent. And we have had many, many members who are important to us to keep us strong in the community, such as Senior Concerns, Dignity Health, Los Robles Hospital, Community Memorial Hospital, hospices, public agencies, attorneys. And on that whole idea, it is not just about the medical field in the way we set our goals in life. It is about all of our life and understanding that knowledge. So I am excited today to give you the bio for Amy Coleman, who is going to be speaking to us about the positive things and the lessons learned at Los Robles during the last year of the COVID pandemic. So Amy is the Vice President of the Community, Employer, and Government Relations for the Los Robles Health System. Amy has been a member of the Conejo Valley for over 4 decades. As a proud and diverse community leader, Amy has dedicated herself to a career in hospitality spanning over 30 years. Coleman served as a general manager of the Westlake Village Inn for over 23 years and followed as general manager with Lux Hotels in Los Angeles before joining the Los Robles Hospital team in 2016. Amy was awarded Manager of the Year by the San Francisco Business Journal, Woman of the Year by the Greater Conejo Valley Chamber, and most recently awarded the North Star Award, the National Court of Honor for volunteers who have made significant contribution to Scouting. She currently resides proudly on several boards representing Amy's steadfast commitment to community relations, academic, and philanthropic excellence, as can be seen in her tenured board member appointments to the American Heart Association, the Alzheimer's Association, Safe Passage, Senior Concerns, Support for the Kids, Pepperdine University, and Medical Explorer 911 Post. Amy is thrilled to be at Los Robles Health System, back in the community she loves so much, serving in a position of leadership and great purpose. I am very excited today to introduce Amy Coleman, who is, you're just an amazing lady. I didn't know you did all those things. So it's when you attend and you have your input, it's always valued. So thank you for sharing today.
Terry, thank you so much. And as I look around this ribbon up above me, I just want to thank each and every one of you for what you do in our community and what you have done. Certainly the decades that you serve and the people. I think when I hear those things and I think about my past and my history, I'm so grateful that my body of work has brought me to Los Robles, because I really do feel like it was a God thing for me to be here. And I feel so grateful and honored to be serving my community and to have served during a pandemic and whatever lies ahead. I just feel grateful. You know, when I first took this job, many of you have heard this, but when I first took this role, and I had served on the board of trustees here for many, many years. And that's what I developed many relationships at Los Robles. And, you know, people would say to me, really, you like working at a hospital? And they kind of scrunch their nose and, you know, kind of smirk and make that grimace. And I said, yeah. I said, are you kidding me? These people speak my love language, you know? And I think that when I look back, you know, who knew at that time to the level that we'd be serving. I served during the borderline, you know, mass shooting, and then shortly after that, you know, the fires, and just in general being a level 2 trauma center in the county, the impact of what we serve. But I have been so overwhelmed by the quality of the human beings that I work with on a daily basis. And the quality of my life has improved so monumentally because of those that I'm surrounded by. So I'm already crying. So there you have it. But that's because I care, and because emotionally, I think this year has moved all of us. So I want to talk to you a little bit about that. Terry, thank you for inviting me. I'm going to share a little bit about, I feel grateful. Now, like I jest and I joke, I didn't get to do Zooms in my, pajamas. None of us, we had to show up, every single day. None of our closets got Maria Conda'd, and the socks didn't get to lay happily, we all had to come to work. And it was a struggle. It was a struggle in the beginning, and then we kind of found our cadence. So I want to talk to you a little bit about that and what I experienced being sort of, behind the scenes and in the walls of this hospital in a 24/7 operation, and what we prepared and what we learned along the way. So as many of us, we became aware of the word pandemic, right? I mean, who knew that that would be a word that we would use on a daily basis? And with that word comes a lot of fear, a lot of anxiety, and all of the unknowns. So the most impactful unknown I think we can appreciate was we weren't sure about this virus. We didn't know how it was spread. We didn't know how contagious it was. We didn't know if it was contact. We didn't know if it was airborne. We didn't know to what degree. During the first few days, it was don't wear a mask. It was whatever you do, don't wear a mask, conserve PPE, and don't wear a mask, but don't touch anything. And then we quickly, we grew into CDC guidelines and WHO. And even with that, it was changing morning, noon, and nightly. So that created some panic amongst our staff, amongst our, certainly our patients, and our physicians. So immediately we set up a COVID committee. I was grateful to be a part of that. We met every morning at 7 a.m. and we set up incident command centers. So we would have daily briefings and then disseminate that to different areas of the hospital as needed. We call them huddles. And those huddles would occur as needed. They were morning, noon, and nightly, as you can appreciate, as things were changing and as communication in a 24/7 and the variables of what can and will happen in a 24/7 operation has to occur. It was important for us to be nimble. It was important for us. There's a saying that I learned in working in healthcare. It's one thing to be on a board. It's another thing to be working here. They say, and I thought it was very apropos, that to change things in healthcare, it's like turning an aircraft around. It doesn't move very quickly. Well, we had to learn to move quickly. And we had to learn how to disseminate information vertically and horizontally, and to infuse that with great confidence out to our team, to make sure that none of the batons were dropped. So again, this communication. Policies and practices were changing hourly, certainly daily, as the scientific guidelines changed. And with lockdown, access was limited. Unfortunately, we had to limit visitation, which was very painful for our patients, very difficult, as you can imagine, for our families and for communities. And can you imagine dropping off your loved one and not being able to really communicate with them? As many of you know, and as many of you have been, we had over 700 volunteers at this hospital that we had to tell them they had to stay home. So that impacted our operations and our staff that relied on these amazing men and women and students that were helping us run the daily operations of the hospital. And we had our vendors. We had to take down our access to all the hospital. As you can appreciate, there's a lot of doors, there's a lot of ins and outs. We had to make sure there was only one entrance and one exit. Setting up a PPE depot to ensure that all staff, physicians had 24 access to what PPE that they needed, that an educator was available 24/7 to round and to ensure that appropriate use was available to them. Many of these individuals, as you can appreciate, had to be retrained into different areas of the hospital, preparing for the impending surge, and certainly to prevent further outbreaks. So again, we were, complying with regulatory bodies, shutting down access to care. We had to close down our elective surgeries. We closed down TOSH, all of our outpatient surgeries, and that created, again, some anxiety, some fear, and some internal turmoil that we had to certainly work through. We had to to disseminate information to staff and how to accommodate those with medical conditions requiring employee health, certainly engaging our human resource team to be accommodating to them. And it was important that we stayed nimble and were able to fluctuate with these changes in volumes and demand and regulations as we were receiving information that was coming in and learning best practices from not only other hospitals, but what was happening in different regions of the world, of the nation, of the state, of the county, and trying to stay one step ahead. So initially with all of that, as you can appreciate, volume dropped to all-time lows because we didn't actually see that initial surge in the second quarter like other parts of the country. You know, it's like we were all holding our breath, waiting, you know, for that first COVID patient to arrive. And we were waiting, you know, for the next wave. We were waiting for that, you know. So I think we were all sort of in our own, you know, internal, like what's happening next. We had a hiring freeze, which was the most responsible thing that we could do. We put a hold on all capital projects, as you can appreciate. We held merit increases. All of our leadership took pay cuts. But with that, I think that we were able to avoid a huge layoff. HCA, which is our parent company, Hospital Corporations of America, as many of you know, was the only hospital corporation that I'm aware of, and that was, I did some research on this, that offered pandemic pay to all of its staff. So I think that was really, I thought it was lovely. I thought it was wonderful. For those that were usually working their 40, you know, hours a week, if they were cut to, you know, if their hours were cut, they were offered 70% of that pay. So those whose hours were reduced, at least they were offered some compensation, very thoughtful compensation. So once May hit, we realized that tsunami wasn't coming that we were expecting like everything else. So that we slowly started to reboot and restart our elective surgeries in May of 2020, restarting our outpatient services. Most of our business lines came back for the most part. They were about, you know, ranging depending upon the departments, anywhere between 5 and 8% below the prior year, except for our emergency services, which I'm sure you can all appreciate, dropped anywhere from 30 to 40% at times below the prior year. So, you know, as so many, they were afraid to come to the emergency room. They were afraid of getting COVID if they came to the emergency room. So we spent a lot of time educating the community on how it was safe to come to the hospital. It was safe to come, you know, for the care that they normally would. And we wanted them to seek, you know, us. And there was a lot of internal guidance how to make them feel comfortable. Our concerns were, what we were seeing were people were delaying care. So when they would come to us, they were coming with more emergent and sometimes catastrophic, if you will, outcomes, or ones that required more care and unfortunately disabilities that couldn't be remedied. Meaning that if they were having a hemorrhagic stroke, we had one patient, and I think I shared this, Terry, with you, that you know, came in and had a hemorrhagic stroke and was blind, and there was nothing that we could do because they waited 9 days to come in. You know, we had others that, you know, I mean, for lack of a better word, were sitting, you know, in their easy chair, you know, and were afraid to come in and call 911, having heart attacks. Those that were delaying, you know, oh my gosh, I've never seen so many appendicitis that had gone septic, you know, during that time. Just terrible, terrible. Whereas normally, so I think it was, and that was seen across the nation. So that wasn't isolated just to us, but they were fearful. So we did a lot of care and concern from the front line, from curbside, making sure that they felt comfortable coming in. But nevertheless, it was very painful and very hard because they couldn't have their loved one come with them. They had to drop them off curbside. And I think that was a real challenge for all of us. So again, waiting for these numbers, waiting for this surge to come, kind of going through that little bit of a up and dips and climbs, and y'all lived here, so you know what we saw, until it came. Until it arrived, until that tsunami finally came. And it started in November when our surge hit and our numbers grew. And our numbers grew to the 10s, to the 20s, to the 30s, to the 60s, to the 80s. And when we went over 100, you know, and we would sit in those meetings and we could see this incline, didn't know where it was going. So we peaked at 118 at most part. We had the most COVID cases in the county, cumulative cases in the county. And we had to make daily adjustments. But with that, as you can appreciate, we had to accommodate different areas of the hospital becoming a critical care unit. So certainly our cardiac and critical care was a COVID unit. Our ICU became a COVID unit. Then we had to move into 3 medical. Then we had to move into 3 south. We had to move into 4 surgical. We had to move into 4 ortho. So you can imagine where we had standard floors for standard care suddenly became an orthopedic. Became a COVID unit. So we had nurses, we had respiratory therapists, we had outpatient physical therapists that had to be retrained, new PPE, had to be retrained to work in COVID units and to be giving critical care. So there was a lot of cross training. There was a lot of, like I said, these team members showed up. They rose to meet that occasion and they helped each other. And that's, I think, what was so compelling to me was to see, and Ellen will attest to this. These individuals came in, they said, I signed up to be a nurse. And that's what I'm going to do today. I signed up to be a nurse. I signed up to care for these people, you know? So I think there were just these unbelievably compelling moments, you know, when you walk into critical care. And our critical care team are used to dealing with very, very sick patients, are used to dealing with different levels of trauma and different levels of critical care. But what was so compelling about this was the longevity of how sick they were, how many different layers and layers and layers of care that they needed for how long. And that was what was so hard. They were used to a bigger turnover, a bigger, transitional care. They would get better, but not to have a patient that was here for, 30, 60, 80 days, long term. And that was very compelling. I will tell you, lighten the mood a little here. We did have one of our first COVID patients that was here, and I can share his story because it was in the LA Times, it was in NBC, it was in Acorn, many of you may remember. And he was a lovely, lovely man. And he was so sick, and he was in our critical care unit for 63 days. And he arrived in April. And when he woke up at the end of May, can you imagine arriving in the emergency room, walking, talking, thinking that you were going to just stop into the ER, get a quick IV and antibiotic, and, maybe you have to spend a night or two, and waking up, 45 days later. And to his sense of humor, he said, "Oh my God, where's my car? Is my car okay?" He said, "I parked it in 2-hour parking." So, I hope you're all laughing, you're muted. So, but God loved him and his family, and thankfully we celebrated him because he left this hospital through the front doors of this hospital into the loving arms of his family. And he's doing wonderfully now. He's doing beautifully now. And I love being able to tell that story because there were so many sad stories, as you know, that we sadly, they didn't get to see their loved ones return home. And I think that was so humbling about this virus and about the severity of what, the amount of death that was around us, the amount of fear that was cumulative, and how that impacted all of us as human beings, how that we saw, that impacting our teammates. As you can appreciate, here they were wearing their PPE, their PAPRs, their COVID gear, entering into COVID units every day, and their spouse or their partner perhaps had lost their job. They had aging parents that they were concerned about. They had homeschooled children that they were trying to deal with, and they were afraid of what they were bringing home too. So there was a myriad of emotion, and a lot of compelling stories. And I remember, and still to this day, just checking in on people. And I loved the way everyone certainly was there caring for the patients. They're there to receive that clinical care, but we were all there as a family, caring for each other emotionally as well, lifting each other up. And as I used to say, taking turns being crazy, because we had to sort of take turns in sort of just checking in with one another emotionally. So we had to close all of those departments again. We had to close back down our elective surgeries. We had to close Tosh again. We had to open up the surge space in the emergency room, set up our COVID and critical care units out in a tent in the first floor there of the garage, separating our COVID patients from our other level 2 trauma, or those that were coming in for a stroke or STEMI or heart attack and what have you. And then we reopened again in February, and staff from all of the outpatient areas and surgery areas were redeployed. So, but our nursing team were the ones that really pulled through. And I have to tell you, we have an amazing team of physicians, certainly attracting some of the best. But what I found to be so absolutely moving were the nurses that were here, during their 12, 14, sometimes 17-hour shifts, not leaving until it was the safest thing to do for the patient, and the way that they were caring for each other in that process and passing those batons. Can you imagine? I mean, we had other clerical support. I mean, we had housekeepers that had to clean COVID rooms. We had our diet and nutrition that had to go into COVID rooms. So there was a lot of us that had to pivot and turn. We've heard that term about the ability to be resilient, but I got to witness it every single day. And as I said before, there were heartbreaking moments, but within them, almost in the same breath, there were heartwarming moments. And it was the hardest time in our humanity, but also the best of humanity. And you saw, again, those people, like I said, showing up and rising up to meet whatever the day brought. So bringing that back in at the end of February of this year, 2021, and now we're ending March and looking into April, we are settling into what is our new norm. We don't know what that will bring. Most of you hopefully have received your vaccinations, and we're hoping to see, herd immunity take over not only in our county, but the nation and the world. But I think there is still that fear, that little asterisk that we're all concerned about what's coming next. We're reading and we're hearing about another surge, a potential wave. We know that, with spring break and all that's coming up, we're concerned. I think we all know human behavior has driven this virus, and that's a concern. That's a grave concern to all of us. So looking at what our business looks like for the next 6 to 12 months and looking out, I think that we are concerned. Our public is still scared about seeking health services. We're still seeing that. So although our elective surgeries have come back, our inpatient services, we're seeing numbers continue to come back to our norm for Los Robles Health System. And all of our facilities, our imaging center, our acute rehab hospital in Westlake, and certainly our Thousand Oaks Surgical Hospital, we are still seeing a dramatic decrease, about 25 to 30% of what we normally see in the emergency room, because people are still afraid. Now, let's also, truth be told, they have also been retrained, right, with telemedicine. They're going to see a lot more of that. A lot of the urgent cares, whereas normally they would go to the emergency room, they're going to our fabulous urgent cares. Los Robles has 2, one in Westlake, one in Simi, and we're going to be increasing those in Agora, Moore Park, Thousand Oaks. You'll see that to come. So I think delaying care is really our greatest concern, and still our educational. In fact, I'm going to share with you, we had this wonderful article that we did. See my team? This is my team. You see these images all over, but these are my peoples. And what I loved, it says, you know, stay strong, stay smart, stay safe, but don't delay your care. Get the care that you need. So we wanted to make sure that they, you know, really took into consideration that, you know, we're going to take care of you just like we always have. We want you to have the confidence. And I always felt that Los Robles was the safest environment that I could be, because everyone was complying, you know, with the standards of, you know, masking and washing your hands, washing your hands, washing your hands, washing your hands. So we don't really expect those volumes to come back anytime soon. And staffing and recruitment continues to be an ongoing challenge as a result of that. So we're tied to that commitment, though. We received a lot of support from HCA, but we did do some changes to accommodate what the new norm looks like in the future. We acquired a warehouse in Florida, HCA did, to stock our PPE and other supplies to meet the company's needs across the nation. So again, that was very, very smart. We didn't have to really rely on any outsourcing of that, which was fortunate and good planning, if you will, business planning on HCA's behalf. We created a joint venture company to produce our own PPE in North Carolina, which makes us less reliant on other suppliers, and it keeps everything here in the good old US of A. Very proud of them for that. Corporate inventories of key supplies that were moved across the country to support surging and patient care needs, again, based upon different parts of the region or the nation and what their needs were. And we developed a very robust IT platform to track and trend that data, and again, share best practices moving forward. On a local level, recruitment and retention become our number one goal. We're still dealing with an aging workforce that I'm sure you've all heard about. So many of our physicians are either of retirement age or are getting ready to retire. So that combining with a lot of, you know, the buzzwords that we hear, that there's a mass exodus in California. We've seen a lot of people moving to Texas, to, you know, Oregon, Washington, Idaho, what have you. And that includes our team. In fact, we lost one of a couple of our critical care nurses. They just couldn't afford to live here, you know, and I think a lot of them were also kind of just burnt out, needed a break, and this kind of made them, you know, really question their lives. I think we've all done that. We've all questioned, you know, this last year and what it's looked like. So that reality has hit us too. And, you know, as much as we know the Conejo Valley to be one of the most sacred, beautiful communities in the entire world, the affordability has been a challenge, and housing is a challenge. So we are still dealing with that, and that is of concern with our recruitment. So with that, we have fabulous grad programs and a great partnership and relationships with our nursing, radiology, respiratory therapy, lab rehabilitation, and partnering with CLU, partnering with Moorpark, Ventura College, certainly Cal State University, CI. You know, they just do a great job, and a lot of our new grads are coming there. So we're wanting to make sure that when they come and work with us, hopefully they stay and they find a home here at Los Robles and stay with us. So with that, I'm very excited that we are also launching. We had to delay it a year, but we are going to be launching our graduate medical residency program July 1st of this year. And that is just absolutely so exciting that we're going to become a teaching hospital. So this last Monday, we announced that we had 20 internists that were a complete match. So when that's pretty exciting, because when you send out the letters, and I'm learning this process as we embrace it, but you send out those letters, they have to receive you at the same time. So it's very rare that when you send out 20 letters, all 20 residents accept. So that was pretty cool. I think that's also a compliment to the reputation of Los Robles and just this new generation of physician workforce that's going to be coming with us. And you'll be hearing a lot, because we're going to be doing profiles on these young men and women, and 5 of them actually are homegrown. So that's even cooler. We've got one from Calabasas, we've got a couple from Thousand Oaks High School, Westlake, Moorpark. So you'll be hearing profiles about these young men and women and coming back to the community. And we're very excited. We partnered with CLU, our neighbor. They're going to actually be allowing them to stay in the dorms there during the transition until they find their way and where they want to live and what have you. So this is pretty exciting for us because studies have proven that 70% of those physicians stay in the communities that they serve and they do their residency. So we're hoping these young internists continue to serve Los Robles and serve our surrounding communities. So we're very excited about that. We'll start in April of next year, emergency services. Then we'll be adding neurology. Then we'll be adding anesthesiology. Then we'll be adding mother-baby. Then we'll be adding orthopedic. So every 6 months or so, we'll be adding anywhere from 10 to 15 incremental new residents. So we're pretty excited about that. So I'd love to talk more about that later. And then our service lines, as I mentioned, we're going to be continuing to expand our urgent care, our own telemedicine, and focusing on, continuing growth and development. As you know, I'm very, very proud. Even during a pandemic, we continued to excel first in the nation, first in the world. We were the first hospital in the United States to conduct a Watchman FLX, which is a procedure for AFib. That occurred during our pandemic year. We were the first hospital in Ventura County to perform cryoablation for another treatment of AFib. We, for the third year running for our Dr. Susky's acclaimed advanced wound care healing, was recognized for a National Award of Excellence for the third year in a row. And he remains in the top 3 to 5% in the nation, what he's doing in our wound care, and that's right here at Los Robles. And of course, this has been a compelling year for him as chief of staff. I don't know, anyone who wouldn't say that, whether you've been in healthcare for 50 years, or 5 years, like myself. It's been a compelling year. We were the first hospital in the world to perform the first mitral clip G4, which is for minimally invasive treatment of mitral valve regurgitation. Dr. Chi and our Comprehensive Cancer Center were revered and recognized as a top 10% comprehensive cancer centers, much that's the likes of MD Anderson, of Sloan Kettering. So that's remarkable, and that's right here. So again, that's what I would expect. So we are still attracting the best talent in the country, the best talent in the nation. We want to continue to deliver those. We're participating in over 20 clinical trials, which is very exciting. And I think what our mission will continue is to be the most trusted resource for compassionate care and the best in class inpatient experience. And that is our continuing goal. So, we're not perfect. I don't know any 24/7 business that is. It's been a humbling year, but I will tell you from our CEO, Natalie Musi, who I think anybody in this hospital literally would lay down for. She's such a humble, amazing leader. And I have seen her rise up. And of course, mother of 3 young children herself, being homeschooled. Our chief medical officer, Gabriella Sherman, who started in April during a pandemic. We just have a remarkable team. Everybody who just really rose together, regardless of what day it was, managing the needs. Ellen and Laura Zempel, who you all know and love, they're used to having difficult conversations. They're used to doing that. That's what they do. They are incredibly gifted at that. But to have these conversations of this caliber and of this magnitude was also overwhelming. Ellen knows this, and I've shared this recently with Laura. Laura taught me a huge lesson. She taught me that no is a complete sentence. And that's hard for us to learn sometimes. I went to her one day and I needed her help, and it was, what I go to, 1-800-LAURA, right? And she said, no, I'm done. I'm out. I'm tapped out. My bandwidth, I have nothing left. And I was like, okay. It's like, well, I didn't know she was allowed to say that. Wow. But what she did is she taught me a lesson that I was allowed to say that then. I was allowed to say, I can't, the water level is here. I can take it to here, can take it to here. I'm pretty good. But when it comes to here, I'm out. I have to tap out. I have to tap out. I'm done. You know, and I thought, wow, that was brave of her. And she taught me a huge lesson. So I think we all needed to know, you know, what our level is. And I'm one of those. And Andrea knows, I know she's shaking her head. I can go into fifth gear, you know. I'm one of those, we all know our strengths and our weaknesses. And I'm one of those, you know, I'm going to run into the fire. I'm going to run into the eye of the storm. And I can go into fifth gear and I can stay there a long time. But about June of the next year, my hair is probably going to fall out. You know what I mean? And I'm probably going to get like eczema and psoriasis and IBS and stuff that I never had before. You know, the body doesn't lie. So I think we all know that we need to be smarter about that. And we're addressing that now because as things, you know, the numbers are down, we're down below 10, you know, and we're hoping it stays that way. We don't really know what's to expect, but it's an awkward, you know, it's sort of an awkward new norm to walk into ICU, to walk into CCU. And, you know, the first time I did it and nobody was wearing PAPRs, you know, and I was like, ah, somebody left a door open and there's a patient sitting in a chair, you know, how wild that would be, you know, the new norm. So these are some of the people that I get to work with, this incredible team. They were on the front line, you know, our emergency room, the chief of staff, you know, and those amazing men and women and nurses that just absolutely touch my heart. And we are so lucky to have a hospital of this caliber in our community and continuing to expand. We're now expanding our helipad to accommodate Blackhawks. So that's happening right now. We are adding 2 new operating rooms. We are getting ready to open in April a brand new radiology department. We're going to be expanding our emergency room and services there, doubling in size. We're renovating all the areas and public areas of our hospital because that's what this community deserves. And we're preparing for whatever comes our way. And there's never been a time that I felt more confident in this team and what we can accomplish together. So it's pretty awesome. I could tell you all kinds of amazing stories that, you know, yes, have everything to do with clinical care. But again, it was that pulmonologist checking in on a COVID patient who was intubated and realizing by looking at her chart that it was her birthday. And he sang happy birthday to her in CCU. Because that was, you know, that was the most human thing he could do, you know, and just the stories of how they were caring and loving and seeing these patients that were, you know, making sure their oral care was taken care of, making sure that, you know, they had time to FaceTime if they were able to with their families, you know, that the music was playing, you know, just those tender moments of how our team cared for these human beings as if it was their family members. And those are the stories that I will continue to tell. And those are the stories that move me every single day. And they show up every single day. I'll tell you a story that happened this last weekend. And it's really near and dear to my heart because it was a patient and a friend of mine, and nothing to do with COVID, but she had advanced Parkinson's, and her family had decided to honor her wishes to be an organ donor. And so we lined the halls and did a legacy honor walk from her bedside as our team, a receiving line, took her all the way down the halls into the operating room where she would be given the gift of life. And to share those moments, those are mission moments, you know, and those are compelling, absolutely just compelling. It's, again, the best of humanity. So with that being said, are there any questions?
Yes. Thank you, Amy. That's a moving story. And actually, Oh, she had to go rescue
Like,
herself here.
get a
Yes.
Kleenex here. Just clean my face off here. Kleenex.
That's a great Kleenex. I was going to ask you about stories, so thank
Oh, I
you for
have so
doing
many.
that.
Oh, I know. So many stories.
The stories are what make life so real
Oh,
for us. We live our own personal story, and sometimes we don't relate to
yeah.
what's going on in that building until we hear the stories. And you know, you're sharing that lady's life, her organs with the world is huge.
Pay it forward.
And
That was so brave. Yeah.
it
Oh,
is.
and I just I can't let this moment and this hour go by without telling you the overwhelming outpouring of love from every kindergarten class, every high school, every band member, every National Charity League, every Girl Scout, Boy Scout, clergy, church, a community, HOA, and you name it. I mean, it was overwhelming, from the card and lawn signs to handwritten notes to outpouring of donations and food, and just an outpouring of love and support. It was so touching and so uplifting, that our staff, that was really what kept them going, that everyone was really cheering them on. And healthcare workers have always been heroes, but for them to be recognized, and I hope that will be a continuum of the, I mean, they are just caregivers, and their lens is always facing out, always facing out. And I will tell you, those mission moments are always there. If you're looking for them, they are always there. And if you are open to it, they find you. They find you. You don't have to go looking for them. They find you.
Is there any special story related to that?
Mission moments? Oh my gosh. I don't know. Help remind me. I've told you some. I have so many mission moments.
Because we know that, actually last year in that mission moment and that whole year was the year of the nurse.
Yeah.
And that to me was an amazing year for that to happen. The year of the nurse, completely. And everything happened.
And with all due respect, I mean, I love our doctors, and yes, but the nurses run this hospital. They run this hospital. Only second to the volunteers. We all reported to the volunteers until the volunteers were there anymore. They definitely ran the hospital. But these nurses, they are just special people. I mean, when you say you were born to healthcare, but again, that's what I loved about the way the community took care of them, because nurses aren't, they're always taking care of everybody else, right? Makes it really easy to take the shift off of them. So we had to make sure that we were taking care of each other, and the community definitely showed their love to take care of our nurses, But yeah, mission moments are everywhere. Mission moments are everywhere. There's so many stories, because we still had, the moms that had their birth plan, and I don't know how many of you know young moms these days, but their birth plan is very important to them. It's like very important. And when UCLA and Cedars and Keck and all St. John's, everybody at the inner city hospitals were saying, drop that girl off at the curb and pick her up in 3 days with a baby, their birth plans shifted. And thankfully, many of them decided to come out, where it was less dense, the inner city areas. And so we had new moms that we were welcoming that had never gone on, the maternity tour, and they didn't know it was going to be delivering their babies, but they at least were able to have their laboring partner with them.
Wow, so, I didn't know you did that, because
yeah, very carefully we did.
Yeah, very carefully. So you talked about the water coming up to your nose. How did you help individuals not reach that watermark themselves?
Well, some of them did. Some of them did. And I think, some of it was, we had to kind of keep an eye on each other. And, we found out that, if somebody was going through something, we'd share that information, and what could we do? I mean, let's face it, we had family members that contracted COVID, and their family members were very sick. And we had, maybe they weren't, here at Los Robles, but they were in other areas of the hospital, and they passed away. And in dealing with isolation, I mean, I think isolation, the stories of isolation, Andrea could tell them you know, over and over. And if you've read her columns, and I hope you do, and I hope you saved them. You know, I mean, it's impacted all of us, and it's devastating. I think one of the biggest things that, you know, we are still dealing with and are concerned about, you know, is mental health and behavioral health and the ramifications, and that's been very difficult on our team, and we're still seeing that. We're still seeing a huge rise in our children. You know, it's heartbreaking to see these young kids and the despair that they feel in the Conejo Valley, you know, coming in. But it was really, it wasn't discriminating. It wasn't discriminating based upon your age, your gender, your income, you know, what zip code you live in, what car you drive, or how much money you have in the bank. And, you know, many of you have heard me say, you know, it's a very humbling experience to be in an ugly green gown with no back on it, to have no control over your life. And we learned a lot this year. We learned a lot this year. And we learned a lot with everybody else, you know. We learned, you know, how quickly, you know, that we didn't want to intubate them.
Yeah.
And we want to do everything we can to avoid that. So, you know, there's a lot, and we're still learning about this virus, and we're still learning what the future holds. Hopefully all of y'all, you know, have had the opportunity to have your vaccinations. I love my Dr. Barry Statner, one of our lead epidemiologists. He's been at the helm and working in collaboration, you know, with all of our critical care team. And he said it was a great line, and I made him a bumper sticker after this. He said, "The only question you should be asking me about the vaccine is which arm." So I love that one. So Dr. Fauci would tell you, take whatever's coming at you, whether it's Pfizer, whether it's Moderna, whether it's J&J, whatever it is, just take it. And he said, yeah, same thing. Which arm?
Which arm? So, I took it in my left both times. So, so I want to go back. You mentioned a couple of times. What were some of the best practices that you brought out of this that Los Robles has looked at and said, this is a best practice we want to hold on to?
You know, I think it was, again, the ability to be nimble. We were good about our communications, and I think what you saw was a lot more rounding on families, a lot more rounding on patients, a lot more rounding on each other, you know, just tapping in and checking into each other. How are you doing? What can I do for you today? Is there anything I can do to lighten your load? And I think that you saw a lot more of that, because we just realized we were at war with this virus. We were on the front line together, and the only way we were going to get through it, you know, was to really just lock arms, to be there for each other. And, you know, we were going in, and whatever comes our way. And I would see that in so many different areas of this hospital.
So you just mentioned pivoting and learning those best practices and pivoting. And now I'm going to bring it back to a coalition for compassionate care level and say, in that pivoting, and I hope Ellen is still present for this and may even join in the conversation if she would like. In that pivoting, we know that most people do not have advanced care plans, and older people and I shouldn't just say older people, but people with chronic illness don't have pulse. So how did you pivot to have those conversations in most circumstances with COVID?
Yeah, well, Ellen should really speak to that if she's able to. She was the expert. But these were very, very trying times. Ellen, do you want to weigh in on that from your?
Sure. I mean, we had to have these conversations with families who weren't present and who maybe hadn't seen their loved one in days. And that's what made it really difficult. So a lot of the pivoting came to fruition really, or was so helpful when our IT teams put together iPads so we could FaceTime and we could meet with families at least virtually. We made a lot of use of our outdoor tables out in front of the hospital to have meetings and things like that. So that was important. But you're right, Terry, it was a difficult time to suddenly make these decisions. But a lot of the families, you know, they rose to the occasion too. I mean, they understood what they were up against, and And we had some really beautiful, beautiful conversations with some very loving families. So my mission moment that I have to share, because it's my favorite story, is a patient, a very healthy gentleman in his 60s, unfortunately was succumbing to COVID. And it was very important to his children that he received spiritual support from his imam in Macedonia for 4 hours. And they set that up. Our nurses came together, case managers. I mean, one lady completely gowned as Amy describes for you. And that happened for that family. And so it's phenomenal. That's something that his children will carry on forever.
Yeah.
So
We did. We pulled out the asterisks in that drawer when we needed to, you know, we pulled that out because these were challenging times. These were very challenging times. And we realized we needed to, you know, remain human in inhuman times, because it was unfathomable what some of these families were enduring, and the angst and the pain and the sequential thinking it took for all of us to stay one step ahead of that, but to be protective of our team, to make sure we were protecting, you know, them, but also, you know, to be thoughtful and to thoughtfully take into account each patient, each family, each consideration. You can imagine you're dealing with religion, you're dealing with different cultures, dealing with a myriad of unknowns, you know, a myriad of unknowns for us, for them. And again, that anxiety and that fear and anything that we could do to help soothe and to help comfort them. And our team did it 24/7. They did it for these families. They continue to, and they fought right alongside.
Very nice. Thank you, Ellen, for sharing too.
Sure.
I appreciate it. So does anybody else have questions before we finish up here? I do want to, I mean, I could ask you other questions. They're not about the coalition. I would be interested in have ideas developed about how to prevent non-pandemic medical catastrophes such as that septic appendicitis. Has there been any discussion how we avoid this in the future, that whole idea? I won't go to the hospital because I'll get COVID, but yet I'll die of appendicitis. So.
Are you asking me?
Carrie, yes, I was asking you that. Has anybody come up with that?
Oh, for Amy?
Yeah, for Amy. And then I have a question from Carrie. So.
Oh, okay, got it. So yeah, I mean, we're continuing to do education. We're going out. We've done a lot of these Zooms. We have different areas of specificity. All of our physicians and our clinicians in those areas. We're working very closely with, you know, the Conejo Valley Unified School Districts, you know, making sure everything from the dangers of vaping, you know, marijuana and the developing frontal lobe, continuing to encourage people to get their well care, you know. I mean, we're expecting a rise in cervical cancer and breast cancer, different oncological cancers, you know, colon. We're very concerned about what we're seeing, people delaying their well care, you know. So I think that continues to be our primary, is to make sure that when you do need emergent care, please call 911. That's what we're here to do. You're not going to get COVID. We didn't have a single outbreak of COVID ever contracted at Los Robles with staff, nor with you know, contracted here. They came to us with COVID and we took care of them, but you're not going to get COVID, you know, per se, at least, you know.
That's a great bragging point. So Carrie does have a question.
Actually, not a question, I have a comment.
Okay.
I just wanted to say thank you to Amy when I was in the hospital.
Oh,
January. It was the day of the insurrection at the Capitol. It was the all-time high of COVID cases at the hospital, and with a very nice phone call from Andrea, I couldn't see my family, and I had appendicitis, and again, I wasn't going to go to the hospital. I wasn't going to go to the urgent care, and But then I had a friend that was just really persistent and like, you need to go, you need to go. And again, I was by myself for hours in that waiting room, and then having to go into the, recovery and then into my hospital room and not being with seeing family. It was really, really hard. And Amy, you were so sweet, and for not even knowing me very well. Now I'm going to cry. You came and visited me, and that was just so sweet. And I really, really appreciate that.
Of course.
Yeah.
Oh, I'm so glad. I'm so glad that you received the care that you needed and that you
and the
deserve.
hospital was great. And it was, I was basically in a waiting room because they kept everyone separated. And I was in a waiting room by myself most of the time. Nobody else in there. So I would tell people too, I'm like, if you need to get service, if you need medical attention, please go. Don't be afraid. Just
Exactly.
I'm so glad that we were there for you. Thank you.
Yeah, thank you.
Yeah.
Thank you for sharing.
Yeah, I
your
held a
story.
lot of hands of people I didn't know, but I knew that that's what I would want for my loved one too. So it was humbling. It was really humbling. I'm glad you're doing so well, Carrie.
I am.
So-
Thanks.
Thank you,
I didn't
Carrie.
even know.
I'm gonna break in here because I got a message saying that we have to close. So I really appreciate you sharing, and I really have to say the personal stories are so important, and knowing that people really do care was a huge part of this.
Oh.
And you can share, even though this was a low attendance for the Coalition for Compassionate Care, this is important to share this link so people will understand the humanity behind what happened in the last year. And if you are interested in being a member of the Coalition for Compassionate Care, I will encourage you to do that. Go to vcccc.org. It's v4cs.org. And then also, we don't have a plan right now for the next general meeting, but be looking for the flyer and for that conversation, because this is a place we can link together and grow in how to educate each other in end-of-life conversations and planning. So thank you very, very much. Thank you to Senior Concerns for hosting the Zoom link. They make it a great place to be. Thank you all for attending, and please feel free to visit the website. Thank you again, Amy. I appreciate it so much.